And first at 5, long lines across the city telling the story of another holiday that is continuing into the new year.
Yeah, fear that the Omicron variant can pass through cloth masks is frustrating the people who are trying to stop the virus. So you have that, plus a shortage of at-home COVID tests across the region, and that is creating some very long lines at testing sites that are taking walk-ins.
That's right. In the week after Christmas, many people are now realizing the one Christmas gift they really, truly wanted and needed is no longer available.
It's very hard to find an at-home test right now.
Chris Castillo just wants to know if he has COVID, but he's learning it's not so easy anymore.
We went to one of the emergency rooms, and unless you're admitted, they're not doing any COVID testing or flu testing right now.
The lines at this testing site at the University of the Incarnate Word are long, but people are willing. They've been gathering for the holidays, and they're looking for peace of mind.
I've had a sore throat and some coughing, but I just presumed, allergies, Texas.
But now one of Veronica Heckerman's family members is positive, and the at-home tests that were so abundant last week,
right on their counter. They had so many.
Not anymore. Online sites are sold out too, with delivery promises not until the second or third week of 2022. And that's not all. There have been recent reports that the variant Omicron can break through cloth masks, and that is frustrating healthcare providers who want and need us to remain vigilant, especially in areas where this virus will spread.
The better masks or the higher filtration masks are better than others, but it's really a combination of human behaviors that really can reduce your risk of infection.
He admits COVID fatigue is real. His hope that the White House can make good on getting more of those at-home test kits into homes.
Hopefully that they'll be able to manage those distribution issues, because all of us feel that adequate supply of testing is again another element of our tools. I think we'd all like good news.
And maybe here's a bit of that good news. If you are diagnosed with COVID-19, the CDC is now recommending a shorter isolation period. As of today, the CDC cutting the time of quarantine from 10 days to 5 days. That also goes for those who you've come in close contact with. The CDC says there's growing evidence that you are most infectious in the 2 days before and the 3 days after your symptoms develop. You can read more about this on ksat.com.